Thank you for coming here. The first talk is on yoga in brain health. And nowadays, there is a lot of talk on yoga is going on all over the world. And I'm also one of the specialty interest group chairperson for yoga in World Federation of Neuro Rehabilitation. And a lot of scientific work is also going on yoga. Not a lot of scientific work has been done on yoga and many medical disorders, including brain health. So today I'm going to focus only on yoga in brain health, because the motto of the World Brain Day is brain health and prevention, protecting our future. So that is the motto of the World Brain Day this year. So what is yoga therapy? Because yoga has been applied as one of the therapeutic measure in medical disorders. Application of yogic methods for healing of diseases is called yoga therapy. It is simple. It is not expensive. It is scientific. It has a preventive role as well. Because there are times we see people who cannot afford a lot of intervention, technology, and especially on a daily basis for long term. It's very expensive for many people in many parts of the world, especially in developing nations. This kind of measures is simple, not expensive, scientific, and has a preventive role as well. It's a very good add-on therapy. So one thing we have to keep in mind while doing yoga is not asana. We always think yoga means yoga asana. Yoga is the way of life, meditation, pranayama, healthy lifestyle, and all those things. So it's very important to understand that yoga is not only asana. So proper relaxation is very important. We should not keep the body very tight while doing yoga. And by continuous work, the natural efficiency of the body and mind diminishes. We work very hard. We don't take any break. I think the recent study found that people who take intermittent break, they live longer. There is a less vascular morbidity compared to people who continuously work for a long time. Rest and relaxation gives the body a chance to recharge. It's very important to keep in mind. Rest and relaxation are very, very important. Yogic methods give this. Yoga Sutra of Patanjali. Patanjali is the father of yoga, and many yoga methods are known for 5,000 years. What is Yoga Sutra? Yoga is suturing the wounds of life. We damage our body in many ways by the way we live, the way we work. We don't take care of the body. We produce a lot of wounds in the body. Suturing the wounds of the body by yoga is called Yoga Sutra. So yoga has many benefits to the body, mind, and improves the well-being of a person. It improves the strength of the muscle and its tone. It improves the balance, posture, and flexibility of joints. Deep breathing and relaxation methods reduces the anxiety. Because we know that psychosomatic disorders, anxiety, stress are very major cause for many medical disorders, because a lot of connection between body and mind. In meditation, we take, as I was telling, that yoga is meditation, pranayama, and then asana, mudra, which I will talk in the coming slides. In meditation, the attention is focused and unnecessary thoughts are controlled. It helps to enhance physical and emotional well-being. It improves the body-mind coordination. There are different types of meditation, like guided meditation, chanting meditation, mindfulness meditation, and transcendental meditation. We focus into something, and the mind is not disturbed with other disturbances. That is basically meditation. So it lowers oxidative stress, it lowers the blood pressure, it enhances the pulmonary nervous system function, it improves the mood, sleep, and quality of life, and reduces the medication use. Pranayama. Prana means life energy, and yama is control. There are many types of pranayama. Breathing awareness is a kind of meditation practice. We are not aware of our breath many times. And if you use the smartwatch, you know that the smartwatch warning with it, you're not breathing for some time. Kindly breathe. And it tells that how, while under stress or while practicing, that sometimes we stop breathing. Then the watch has to give a reminder to us that kindly breathe. Breathe for 1 minute like that. So there are many ways of doing it. Hands in and out, hand stretch method, and ankle stretch method. There are many stretching methods we can do along with pranayama. In all these methods, one should breathe in and breathe out slowly and deeply. Along with above breath awareness methods, one can do stretch exercise like spinal stretch, lateral stretch, and twisting movements at hip level. We are not aware of our breathing. Do it involuntarily and without our consciousness. Breath control is pranayama. Many people have one or both nostrils partially or subtotally blocked due to various reasons, and the lungs are not adequately inflated, which can lead to breathlessness while exerting. Anxiety can lead to hyperventilation. Breath control is managed through pranayama. Improving oxygen supply to the body rejuvenates it and helps to extend our life. The advantages of doing pranayama are it reduces stress, anxiety, improves sleep, lowers blood pressure, improves our breathing and brain power, the cognition improves. Pranayama can be practiced alone or in combination with some of the asanas. In my practice, neurology practice, many patients, I do them, teach them some asanas and pranayama meditation, sitting position itself, along with the patient that I also practice so that my stress level coming down. So I practice pranayama and meditation along with the patients. It just take few minutes to teach them. At the same time that we can also relax, and it makes our body to heal better because we are continuously working under stress. Nadi Sudhi Pranayama, because of copyright issue, I used to take my photograph and put it so nobody can ask me that where you taken the photograph. This is basically the left hand is in the Chin Mudra position. Nadi Sudhi Pranayama is alternate nostril breathing. It balances the energy flow between right and left side of the body. Nadi Sodhana Pranayama, in addition to alternate nostril breathing, breath is held after inflation for a few seconds to avoid this in cardiac patients. For example, right side is called the sun and left is moon, and right eye is sun and left is moon. And you block one nostril, inhale, then block that and exhale to the other nostril. That's called alternate nostril breathing. While you are inhaling and hold it for a few seconds, some people hold even up to 32, 64, and then you exhale. That is Nadi Sodhana Pranayama. Better to avoid this in cardiac patient. The most safer method is Nadi Sudhi Pranayama. That is alternate nostril breathing without holding the breath. Bastrika, it is bellows breathe. It is more advanced pranayama. Like other pranayama should be practiced in empty stomach. Most of the pranayama should be practiced in empty stomach. You should not do with full stomach. Sitali pranayama and Sadanta pranayama are other advanced pranayamas. Sitali pranayama, you have to fold the tongue, you have to suck the air, close the mouth, and exhale through the mouth. And Sadanta pranayamas, you have to close the teeth, put the tongue in the back of the teeth, suck the air, close the mouth, and exhale through the nostril. They are called Sitali pranayama and Sadanta pranayama. Kapalpati means shining skull. It's a short and rapid expiration with normal inspiration. And it is very good for cleaning the nostril and throat, and all the secretions will come out. It is good for diaphragmatic movement. Brahmari pranayama is humming deep breath. And it is done with the Shanmukhi mudra. Like you have to do like this. Like that. It makes chemical secretion in the brain. It reduces level of anxiety. It makes the mood more peaceful. It gives good sleep. It improves the voice quality and voice volume. So Brahmari Pranayama is known for many thousands of years and practiced all over. There are many papers on Brahmari Pranayama in international literature. Asanas are postures of yoga. Surya Namaskar is a commonly practiced yoga posture, which is a combination of many asanas with regulation of breath. It has many benefits in the joints, muscles, internal organs, mind, and the body. The other asanas can be classified as standing asana, sitting asana, prone asana, and supine asana. Standing, sitting, prone, and supine. I think we have to choose the asana as based on the patient's age, the limitation of joint mobility, underlying cardiovascular disorder. We should not teach difficult asanas to the people. Basically, the concept of asana is to make the joint more flexible and make the muscles to relax. So we have to choose as per the underlying disorder. That's why it's called yoga therapy. So mudras are hand postures. You would have heard these mudras in Bharatanatyam and yoga, and the finger positions is called mudra in yoga. Each finger has one element representation yoga. We know that we are made of Panchaputta, and the thumb is fire, index finger is air, middle finger is sky, ring finger is earth, little finger is water. The different types of mudra are Prathivi mudra, Varuna mudra, Vayu mudra, Aparna mudra, Mukula mudra, and Kechari mudra. If you touch the tip of the top of the palate with the tip of the tongue, and you can give a vibration, it can exactly go into the pineal gland, pituitary gland, hypothalamus. It makes the vibration gives a lot of benefit to the body. So you can do along with that some kind of pranayama also. So these are the different types of mudra. So this is again my hand position of different mudra. The first is Adi mudra, and then Varun mudra is touching the little finger with the thumb, and then Apana mudra, then Prana mudra, that you have to touch the thumb with the ring finger, little finger, and the two fingers straight, index and middle finger. That's called Prana mudra. And I have sent one paper for publication on Prana mudra and Brahmari pranayama in reducing awakening in sleep. I have done study on 60 patients. So bandhas. Bandhas means lock. There are three types of bandha. So you hold a place and hold it for some time. Then after some time you relax. That's called bandha. And it also releases a lot of energy. It has a lot of effect on the tightening the muscles and improving the muscles of particular region. The Mula bandha is called for strengthening the pelvic floor muscles. It's called Kegel's exercise. And it has a benefit on the urinary region and diaphragmatic place where people have urinary incontinence or some other urinary problem as age advances. And Udiyana Bandha is from abdomen until diaphragm, and Jalandhara Bandha is touching the throat region. So you just inhale and bend the neck a little bit and hold the air close in the back of the throat. That touches the throat region. It helps to improve the thyroid function. It's called Jalandhara Bandha. So what are the benefits of yoga for stroke patients? It improves the mind-body connection. It improves the balance, range of motion and strength. It improves walking and balance, accessible for all stroke patients. Reminds us to breathe while exercise. It's very important that all very simple like pranayama, meditation, and the patients can be sit and do with less supervision. Even the attendants can be taught how to do that, and it has a lot of benefit to the body because we know that oxygen is healing power, and the cells need oxygen to survive and to get repaired. The main issues in stroke rehabilitation are weakness, spasticity, stiffness of joints, muscles and joints, cognitive problems, urinary dysfunction, anxiety, and stress. The yoga methods as an odd and measure are cost-effective, simple, need a mat, floor, or chair, and can be done at home. Yoga methods improve body and mind interaction, improves balance, strength of muscles, joint mobility, stiffness and gait. Even though some are immobile, still they can practice meditation pranayama. So we have to choose the methods as per what they can do, what they can practice. So the mindfulness meditation has the effect on post-stroke spasticity. In a study on post-stroke patients who had mindfulness meditation at home for 2 weeks' time. Post-stroke cognitive and emotional issues like anxiety, depression are common in post-stroke patients and chronic stroke survivors. The benefit is studied in MindFit Project on. It's a randomized control trial. And you practice everyday pranayama and meditation. We know that how much benefit it gives to the mind because our mind disturbed and we're very disturbed or stressed and anxiety. It has a lot of impact on our blood pressure, diabetes, and our body mobility and functions of many organs. So we know that the mind and body are connected. So mindfulness brain interventions improved depression, anxiety, fatigue, and quality of life in people with upper motor neuron disorder. There are many papers published. There are articles in PubMed. So post-stroke patients, one of the main problems is balance, seated, standing, simple yoga measures improved balance in post-stroke patients in a pilot study. They found what are the things they can do because many patients have grade 3 or 4 plus by 5 power. So they can do certain movements. They can even do sitting yoga or seated yoga with standard, some standing simple yoga measures with the supportive measures. Has a lot of benefit to the people. A pilot study on post-stroke patients found multiple physical improvements. They were given 8 weeks of yoga therapy in the form of postures, breathing, meditation, and relaxation exercise in different positions. So this is a paper I published in Indian Academy of Neurology last year. And we done a study on 550 patients on seated Tadasana. That is, you have to sit and you have to hold the fingers and you have to outstretch above your head. That reduces the stiffness of the shoulder, elbow, wrist, and fingers. And plus that you can do pranayama along with that. That is alternate nostril breathing pranayama. This is called seated Tadasana, off mountain posture. It relaxes the body and mind as well. It is also one of the ideal positions for meditation. It improves the posture, core strength, and helps to align neck, shoulders, and spine. This asana can be done by the patient with less supervision, and all the patients in this study got the benefit. The main aim of the study was to find, because we found that after strokes, many people get a stiff shoulder, which really disturbs the rehabilitation measure. By starting this, because even if one hand is weak, you can hold with the other hand, you can stretch like this, and you can prevent the shoulder stiffness, post-stroke shoulder stiffness, and it has a lot of impact on the spine stiffness as well. Benefit on the spine stiffness as well. The effects of yoga on patients with Parkinson's disease. A meta-analysis of randomized control. The many randomized hospital trials are done in Parkinson's patients. A meta-analysis was conducted by systematically searching PubMed, MBS, Cochrane Library database till August 2020. A study is published in English. Pooled results show the benefits of yoga in improving motor function, balance, functional mobility, reducing anxiety and depression, and increasing quality of life in Parkinson's disease patients. Yoga prevents gray matter atrophy in human at risk for Alzheimer's disease, because as I was telling that, and that we need a very good quality of breath and deep breath, and the oxygen should rejuvenate all the cells in the body. So people found there is, it reduces the gray matter atrophy. This was studied in women, but I think it's applicable to everyone. A randomized controlled trials, subjective cognitive decline and cardiovascular risk factors are known risk factors for developing Alzheimer's disease. So it has a benefit on everything. So previously demonstrated that yoga improved depression, resilience, memory, and executive functions, increased hippocampal choline concentrations, and modulated brain connectivity in older adults with mild cognitive impairment. Benefit of yoga therapy in the management of epilepsy is emerging. However, there is no data available about the knowledge, attitude, and practice of yoga amongst people living with epilepsy. This study was designed to explore the KAP about yoga among people living with epilepsy. More than half of the respondents, 54.8%, were willing to practice yoga. Many people like to do. And the only thing is access, and I think many people should have access to this, which is not very expensive things. I think we already started infiltrating into the all the peripheral areas, and many common people know about yoga. Those who practice yoga find that regular practice of yoga might reduce dosage of medication, their side effects, and frequency of seizures. Majority of the patients were willing to practice yoga if yoga services were offered. Yoga interventions used for the rehabilitation of stroke, Parkinson's disease, and multiple sclerosis, a scoping area of clinical research. The feasibility and benefits of virtual yoga practice for stroke survivors with aphasia. Now people have started doing the tele-yoga consultation, tele-yoga practices, where people don't have access directly to the place where the facilities are available, and they found a lot of benefit. The purpose of this study was to examine the feasibility of a virtual, adapted, aphasia-friendly yoga program for people with aphasia. They evaluate evidence of improvement in patient-reported outcomes and word retrieval. Explore the immediate impact of yoga session on a particular subjective emotional state. Assess participant motivation and perceived benefits of participating in yoga program. You have to keep in mind that some people have global aphasia. They do not understand what we are talking or what we are telling. And I think that situation may be difficult. But once they are in the partially better, they understand what we are doing or they can imitate what we are doing. That's a stage. It has a lot of benefit to these people. The effect of early yoga practice on post-stroke cognitive impairment. Post-stroke cognitive impairment is a clinical entity that encompasses all types of cognitive impairment following index stroke. Yoga has proven to be beneficial effect not only on cardiovascular risk factor but also on cognition. Hence, this study explored the post-stroke cognitive impairment spectrum and assessed the effect of yoga on PSCI. Study reveals that early yoga intervention stroke survivors leads to better improvement in cognitive abilities, which would further facilitate early reduction of caregiver burden. When I practice pranayama or meditation, and especially after long hours, I feel I get some more energy to carry on further, because sometimes at the end of the clinic you'll become very tired, exhausted, and still you have to make a decision. And especially the more seniority you get into your practice, you'll get more difficult case. And in some difficult day, the last patient will be the most difficult case you see in the day. And you'll be exhausted and you don't know what to do, but still you have to listen to the story and you have to come to a conclusion. So sometimes even in the clinical practice, kind of small measures makes the clinician to perform better, because we are also human being like others. So yoga breathing, meditation, longevity. Clinical evidence for the use of yoga breathing in the treatment of depression, anxiety, post-traumatic stress disorder, and for victims of mass disasters. We have seen calamities, natural calamity, people extreme under stress. Not all giving medication is not always a solution. We're talking to them, telling them some simple measures, giving a healthy diet, and consoling them. There's a lot of ways to make the people to feel better. By inducing stress resilience, breath work enables us to rapidly and compassionately relieve many forms of suffering. Systematic review of yoga interventions for anxiety reduction among children and adolescents. They found a lot of benefit in children, especially the children who go through a lot of educational stress and stress at home and performance stress, competitiveness. It's very important to help them by these kind of measures, which makes them to handle it better, their life better, the stress level better. So the effect of yoga on glycemia and lipid parameters, type 2 diabetes, a meta-analytic study proved there is benefit. And systematic yoga for balance in healthy population. Effect of yoga on meditation and tinnitus, systematic review. The present systematic review aimed to explore the published literature on the application of yoga and meditation for tinnitus. 5 studies were shortlisted, included in the present review. 4 studies had used different types of yoga and pranayama, while 1 used relaxation therapy. 3 studies concluded that there were positive effects of yoga on tinnitus, such as reduction of severity and stress, anxiety and irritability associated with tinnitus, and improved quality of life. We have to keep in mind that sometimes natural history will be there. And as I was telling initially, it's an add-on measure. It's not a substitute for the medical approach. So it sometimes a multidisciplinary approach makes the people to become better with many issues which we cannot solve everything. So in conclusion, applying yogic methods in therapy of many diseases has an add-on value and has preventive role as well. Various studies done all over the world on yoga in disorders like asthma, COPD, diabetes mellitus, thyroid disorders, epilepsy, migraine, stroke, anxiety, depression, hypertension, arrhythmias, syncope, glaucoma, voice disorders, pregnancy, sphincter disturbances, gastrointestinal disorder, musculoskeletal disorders, Parkinson's disease, and multiple sclerosis. But today the topic is on brain health, and we know that brain is a very, very important organ, and disturbance of the brain can affect many other organs in different ways. So there are many studies done on yoga at rural areas, schools and colleges, working place to improve the psychological status and to prevent stress disorders. Yoga is simple, cost-effective, can be done anywhere, and it helps to give healthy mind and body. During COVID-19 pandemic time, it has played a vital role in healthcare all over the world. It can be taught through teleconference, and this method helped during the pandemic time. There is a lot of scope for applying further the yogic methods for therapeutic benefits. In many institutions nowadays, separate yoga department is available. So in conclusion, the yoga helps to fulfill the definition of health, physical, psychological, and social well-being. Thank you very much for listening to me.